is Fabrizio Di Costanzo, and I'm a registrar in Medical Oncology at the University of Naples Federico II, Italy, and a visiting PhD fellow at Newcastle University, UK. Today, I'll present real-world data on adjuvant abiraterone in high-risk localized or locally advanced prostate cancer. Specifically, we'll be focusing on PSA dynamics and the achievement of ultra-low PSA levels. As we all know, the STAMPEDE trial demonstrated that abiraterone combined with ADT for 24 months improves outcomes in patients with high-risk non-metastatic prostate cancer. However, evidence from real-world practice is still lacking, especially in less selected patients that might be affected with comorbidities that exclude them from clinical trials. Our aim was to describe the biochemical response to adjuvant abiraterone plus ADT, specifically the timing and rate of achieving ultra-low PSA levels, which is defined as below 0.02 nanograms per milliliter. As such, we gathered data from patients with no evidence of metastasis on conventional imaging, meaning CT and bone scans, and also N1 disease, meaning the pelvic node involvement, or with at least two of the following three high-risk features: T stage greater than or equal to 3, PSA greater than or equal to 40 nanograms per milliliter, and a Gleason score ranging from 8 to 10. We also included 7 patients with cardiovascular disease who had been excluded from STAMPEDE. This was to better reflect real-world practice. As such, in our retrospective cohort of 137 patients, 116 patients, corresponding to nearly 85%, achieved an ultra-low PSA. When stratified for treatment adherence, about 76% of those who discontinued therapy early and nearly 88% of those who continued treatment reached the ultra-low threshold. This shows us that a profound biochemical response occurs frequently, even in patients who are unable to complete the planned course of abiraterone. But if we look at the time to nadir, the median was 5 months for patients who continued abiraterone and around 6 to 8 months for those who discontinued. Even more importantly, in more than 90% of cases, PSA suppression to ultra-low occurred within the first 12 months of therapy. We even had patients who reached the ultra-low threshold after discontinuation, while remaining only on ADT. In conclusion, most high-risk patients achieve early and profound PSA suppression with adjuvant abiraterone. This benefit is seen even among those who discontinued treatment prematurely. The early achievement of an ultra-low PSA in nadir could then serve as a biomarker to guide response-adapted strategies also in this setting, and not exclusively in the metastatic disease. Thank you so much for your attention.